Welcome, everybody. This is Alice Bonner, and I chair the Moving Forward Nursing Home Quality Coalition, and I'm joined by our director, Isaac Longobardi, who will be helping us with technology, but will not be speaking because there's a lot of background noise, but Isaac is listening in as always, and we're very, very happy to be talking about the topic today, which is strengthening resident councils. And it's particularly relevant right now. I don't need to tell anybody in this audience, I'm sure, because, there's so much going on right now in nursing homes related to quality. There's a lot of nursing home closures. These are issues that affect all of us. And very importantly, they affect residents. And so amplifying the voice of residents and really addressing and learning about what matters to them and then acting on what matters to them is very, very important. We need to know, what are they telling us? So we have several speakers today. I'll introduce them very briefly. And then we also have a very diverse audience here. Some of you may recognize one another, some of you may not, but we have people from state and federal government leaders on the call. We have advocates, nursing home residents, retirees, clinicians, researchers, the whole gamut. So if you'd like, you could chat in your name, your organization, what state you're practicing in, and your role in that organization. Isaac put some housekeeping notes in the chat there, but we did have a lot of people sign up for this call today. We had over 200 people. So because of the size of the audience, we're going to say, if there's a comment that you'd like to make or a question you'd like to ask, please feel free to chat that in. Also, if you'd like to speak, everybody's been muted for now. But if you'd like to speak, if you use the raise your hand function at the bottom of the Zoom to raise your hand on screen, then when we see that, we can unmute and just instruct you to take off the mute button, and then you'll be able to speak. And then you can put your hand down when you're done speaking. I'm going to be a little bit of MC and timekeeper today. So as we go through the different people who are speaking, I'll just remind speakers if your time is done and we want to move on, just so that we can get through all of the content on the program and then also have some time for discussion and conversations later today. So again, some of the speakers on the call today, I'll recognize Mairead Painter. I don't know if she's going to be able to join or not. She was in some emergency meetings in Connecticut, but she's the Connecticut Long-Term Care Ombudsman leader, and she also works with NASOP and ACL and other organizations, and she has been the co-chair of the Moving Forward Coalition Resident Council Work Group. So Dan Beam is here. Dan is from Connecticut. He's the Connecticut Community Ombudsman Program Manager, and he's going to be speaking today. Anna Fisher is with us. She's Anna, she's an RN, and she's clinical education director and a quality leader in Nebraska at the nursing home, where she's giving direct care and doing a whole lot of other things. And she also co-chairs the Moving Forward Coalition Resident Council Work Group with Mairead and others. We have Elizabeth Spital here today from the New Jersey Long-Term Care Ombudsman Program. She's going to be talking about one of our pilots. And I see we have Mag Morelli, who's the president of Connecticut Leading Age. And I believe we have or will have Matt Barrett leading the Connecticut Association of Healthcare Facilities. So we have quite a lineup. And so we'll keep things moving. And again, we want to hear from you, and we want to see in the chat the things that you want to tell us about your work. So I'm going to kick us off and just very briefly say that, our overview is that we've been working on strengthening resident councils for the last 2 years. And our committee has really worked tirelessly to bring this program forward. And so the goals of the project for talking about today, when we set up the pilot, is we said we want to develop a guide and a process for how nursing homes will implement or strengthen their resident council programs. And part of that is based on a lot of nursing homes saying, after the pandemic or during, the continued, infections that we're seeing in our nursing home, we just haven't been able to do congregate activities. And so some of the resident council programs that were there are no longer able to happen. And so, nursing homes are saying, how can we get back to that? the other thing is, part of the background is having it be a real program that matches the intent of the regulations and isn't just a check the box, as we might say, initiative, but really is hearing the voice of residents and amplifying the voice of residents. So that's just a little bit of background on the goals of the program that we worked on. And with that, I want to kick it over to Anna Fisher, who's really the person to talk about this, because she, as one of the co-chairs, has worked very much on the development of the guide and process. So Anna, maybe you could tell the group a little bit more about that.
Certainly. Thank you, Alice, for that introduction. And what a delight to see you all. And I'm enjoying reading in the chat where you're all from, what you're doing. Thank you for your continued sharing. I am Anna Fisher, and I'm a nurse. And I will tell you, I am honored and privileged to be invited to the resident council meetings. And I cannot tell you what that does for me. Wow. And so how this really evolved, as Alice said, we wanted to come up with a guide, not to replace what providers or members are currently doing, but to further enhance their efforts on what we can do to amplify the residents' voice. So we did an environmental scan. What does that mean? We were looking through the research, and let me tell you, there was not a lot of research out there on resident councils. So what we did was solicited feedback from other ombudsman state offices, and we came up with a resident council guide. And you know, Alice, I carry it with me everywhere I go, everyone. I have my little resident council guide. I know you really can't see it. But as a result, we wanted to pilot test the resident council guide. And so we did with 4 nursing homes that were in the state of New Jersey. But before we piloted there, we formulated a team, a resident council team that had a broad section of individuals. And let me tell you, first and foremost, we had residents on our team. It's their voice. Our efforts are for them. We also had nursing home staff. We had ombudsman. We had Moving Forward Coalition members. So just a wonderfully a collection, a collaboration of individuals. We solicited their feedback on the guide, incorporated their feedback, and then we made the changes before we launched the pilot testing in the great state of New Jersey. So Alice, I know I only had a few minutes because I could take this entire hour to talk about resident councils. I love it that much. Alice, anything you'd like to add?
I think that was a fantastic overview. And I just wanted to say, for those of you who are looking at the guide and wondering whether you can get a copy of the guide, it's posted on the Moving Forward Coalition website. So if you go to the Taking Action page, you can scroll to the guide, you can download it, and there's some other information there as well. So I'm sure we'll circle back and mention that again. But again, just hats off to Anna and Mairead and the entire committee who really put their heads together. And, we had a lot of very lively conversations, I'll be honest. People didn't agree on everything. And that's the whole point, right? Is to get people with very diverse opinions to come together. But Anna, maybe I'll continue the conversation. And you mentioned the pilot that we did in the great state of New Jersey. So again, I'll start a conversation maybe with Elizabeth Speidel, who's also here. And Elizabeth and I worked together. We actually did some tag teaming with one of the nursing homes of the 4 in New Jersey. And Elizabeth, I'm just wondering, what was your impression of the positive aspects of the pilot work for the nursing home residents? We have nursing home residents on this call. We have one of our steering committee members on and others. What would you say was a positive experience for residents in the pilot?
A positive experience for the residents. I think that it's getting the attention of people outside of the facility to talk to and engage about these issues. I think with the residents that we talk to, a lot of times kind of only being within a facility can feel a little lonely. So just a little bit on the outside feel like reinvigorates them and helps them make reconnections within their own facility among facility and staff. And from my own experience, the positive was people, like getting to engage with the residents and with the staff who are, interested in doing something different and engaging.
Mm.
And
Did you?
and getting to meet you and spend time with you.
Yes, that's right. I know we formed a good bond there. And in terms of the staff and the teams in the nursing homes, what would you say? How did you feel about the role of the long-term care ombudsman? Because we, Anna and Mairead and I would say you guys played an absolutely critical role. But how did you see that role with the staff in particular?
I think sometimes the role between ombudsman and staff can be a little cautious on the staff's part, right? A lot of times, at least within New Jersey, ombudsmen are coming in because of a complaint or an issue that's been raised. So having that more collaborative approach right from the get-go, right? Like that it being initiated that way was, I think, positive. And it was really great to see the staff open to that and excited about that.
Mm-hmm. And so, those are some of the takeaways, are that, the residents are starting to feel more empowered. They're starting to feel like people are listening to them. The staff are realizing, oh, we can really put this together. What about some of the challenges? I mean, again, there's always challenges with a new program, but any particular challenges or ways that we worked through them that sort of come to mind?
Yeah, I think one of the things that's really essential is because we'd been working on doing resident council work before we got in with Moving Forward Coalition, and we're doing our own kind of pilot simultaneously as Moving Forward Coalition. So while there was 4 nursing homes with this pilot project, we were working with a number of them. And it's not surprising, every nursing home is totally different. So there's definitely not a cookie cutter approach. So really working on the toolkit has so much valuable information, but really realizing like the real bread and butter of doing any positive work around resident council is relationships, building relationships with staff and residents in a collaborative and very much peer approach. I think a lot of times in a setting such as this, there's a sense of like being helpful and doing stuff for, and this is something that Mairead says all the time, doing with, not for. And that can be difficult because also the idea that like the resident council should absolutely be run by residents, but lots of residents haven't had the experience of running something like a resident council. Lots of staff members haven't had experience of like, how do I support residents to run a resident council? That is a very kind of like boots on the ground, nitty gritty, kind of like working it through together and figuring out what the best answers are for a particular group of residents at a particular facility and what the resources are there.
Right. That's great. And, again, there were certain topics that came up a lot in the particular nursing home that I was at, activities and, social activities, food. And, we always had the person from the kitchen come out and talk to the residents every single time. She went through a whole, she'd be there for like 20 minutes and it was at their request. So I think that was really helpful. But last question, do you have thoughts for this group about how any of us can encourage more nursing homes that want to do this to sort of get involved? Any guidance that you would like to share based on the pilot we did?
Yeah, so one of the residents just said, even if you don't know what you're going to do, just try. And I would say that is really essential when doing resident council. People want things to go really perfectly and make sure it looks pretty, and it's really not about that. The idea is, what do the residents want and how to help them work with each other and work with staff to achieve those goals. And again, like collaboration is so essential. Something as basic as everybody who's invited to the meeting, residents and staff alike, sitting together, maybe even in a circle, to have that conversation, to figure out what the solutions to the problems are. And then 100% following up when residents raise concerns, that administration and staff, whoever is responsible for that, is coming back and saying, we've heard you and this is what we're doing. Or we've heard you, this is what we did. Did it work? That kind of continuous conversation, I think, is one of the most essential things for resident council. And when you're doing it, like if you're engaged in authentic and meaningful conversation with each other, you're going to weather a lot.
That's right. All right. Well, thank you so much for that overview of the pilot. We did write up a report at the end of the pilot where we worked with these 4 nursing homes and Elizabeth and other folks from the New Jersey Ombudsman program. We learned a ton from them. We learned a ton from the residents. And now we are doing a second phase pilot, putting the program into action again in the state of Connecticut. So we're fortunate to have Dan Beam from the Connecticut Long-Term Care Ombudsman Program. He's been working very closely with us on this, and he's going to talk a little bit about what this is looking like going forward. So this is the exciting part, guys. So Dan, over to you.
Yeah, no, thank you guys so much. And again, so happy to see a lot of individuals, both within the state and throughout the nation, that are interested in this project, getting it started and implementing it to make sure that we have resident councils that are really robust and resident driven. And so as we move into this next phase of the Moving Forward Coalition project, I want to take this time, as we already know, to give some updates on Connecticut. And as we know, we've seen the importance of resident councils in giving nursing home residents a real voice in their community. And the resident council guide's already been developed and implemented in states like New Jersey to make sure that it provides the resources, structure, and support needed for success. Today, I'm going to walk you through where Connecticut is as a pilot state and what the next 3 years may hold as we scale this initiative to make sure that we continue to enhance the lives of residents and nursing homes across the state. So again, just a quick program overview. The Strengthening Resident Council pilot program is a 3-year initiative that began in July of 2024. Connecticut was chosen as the pilot state because of our strong commitment to improving the quality of life for nursing home residents. Our program's central goal is to empower residents by improving communication and ensuring that issues are addressed early, and all while making nursing homes feel like they're a real home for those who live there. And so far, we've laid an excellent foundation with the development of the guide and the collaboration of stakeholders and the feedback from our pilot partners in New Jersey. And in this next phase, again, we're going to work on scaling this program and increasing the number of nursing homes that are participating and collecting data to really measure the impact that this guide is having. So again, the council guide is that core tool for our work in this program, developed with the guidance of the NASM and funded by the John A. Hartford Foundation. This guide provides step-by-step instructions for nursing home residents and staff to form and sustain effective, inclusive, and person-centered resident councils. One of the strengths of this guide is that it integrates best practices while being adaptable enough to fit unique needs of each nursing home resident. The guide is available. Oh, hello. Hold on one second. Gus, if you could just, I'm doing a presentation, so if you could just be quiet while I present, if that's all right. Thank you. All right. So one of the integrations of the practices, and again, COVID again, it's one of those things that we've learned to adapt. So one of the strengths of this guide is that it integrates best practices while being adaptable enough to fit the unique needs of each nursing home. The guide is available in both electronic form, accessed immediately, and I shout out Mag Morelli. I saw you put the quote, or you put the link right there in the chat, so appreciate you for that. And hard copies are going to be sent out to all pilot program participants in the state of Connecticut. Again, the emphasis throughout the guide is on making the councils resident-driven while supporting both residents and staff to work collaboratively to enhance the quality of life of nursing home residents. So, the success depends on the diverse group of participants involved in the pilot project. Starting, of course, with the nursing home residents. Central to the initiative, they will use the guide to establish or enhance the resident councils. These councils provide residents with the opportunity to voice concerns and offer input to their care and community life. Nursing home leadership and direct care staff. Now, their role is to support the residents in forming and running their councils, ensuring that the meetings are effective and that the residents' voices are being heard. Now, the long-term care ombudsman representatives, or the coaches, both act as facilitators and advocates. They volunteer at the nursing homes and work closely with the resident councils to ensure that communication between the residents and the administration flows smoothly. And then moving forward, coalition team members. They provide guidance and ongoing resources to support as needed throughout the pilot program, ensuring that each council functions effectively. Now let's take a moment to discuss some of the specific roles that each participant and ensures that the program is successful here in Connecticut. The nursing home residents, again, they're the ones that are going to be using the guide with the help from the state liaison or the long-term care ombudsman, and they'll use the guide to establish regular, effective meetings that address their needs. And again, as we've discussed, it's meeting them where they are and to a meaningful, using the guide in a way that is meaningful to them. The ombudsman and coaches will be working directly with the residents and staff to facilitate the council activities and ensure that that communication flows smoothly between all parties. The state team lead, this person will support nursing home residents and staff throughout the pilot, acting as a primary contact and any feedback on the guide that the pilot process. And then the nursing home senior leaders and designated staff. Their responsibility is to identify and support staff members who can assist residents in organizing and running council meetings. They will also ensure that councils have all the resources they need. Now, the program timeline. We are now entering this second year of the the second phase of this 3-year pilot. And here's a brief outline of what we're going to expect moving forward. So again, the kickoff was July. This is the beginning of the second pilot. We're currently in the process or the selection of 25 homes. So Connecticut's going to select 25 nursing homes to formally participate in the pilot. However, other homes are encouraged to use the guide and will still receive support from the Ombudsman program and the Moving Forward Coalition larger committee. And then the resident council meetings. Meetings will be scheduled from January 25 through June of 2026 with regular feedback sessions to ensure that we're meeting our objectives and identifying areas for improvement. And of course, making sure that we're checking in throughout the way to make sure that the program's moving forward and on track. So quality improvement, it's a key component of the pilot, and we'll be collecting data through several important avenues throughout this process. Again, similar to New Jersey, a baseline survey conducted in order to get an initial orientation of where the residents are at, and it'll gather the information on the current status of the resident council and the participating nursing homes. And then also again, with a final survey conducted in July of 2026, this survey will assess the impact of the resident council guide and identify areas for further improvement. We'll also be asking each resident council and dedicated staff member to fill out a monthly report on feedback on how things are going. And of course, confidentiality, all responses will be confidential and reported in aggregate to ensure the privacy and encourage honest feedback. So the initial on-site meeting is a critical step and part of getting the pilot underway. During that initial meeting, we're going to review the timeline and goals of the program, identify key individuals responsible for coordinating the resident council activities, establish preferred methods of communication to ensure that smooth interaction between residents, staff, and the Moving Forward team, set an agenda for the first resident council meeting, and discuss that baseline survey we just talked about. And this meeting will provide the necessary groundwork to ensure that each resident council is fully equipped to move forward with confidence. And so, as we've discussed the guide and earlier in this presentation, I'd like to quickly highlight again some of the frequently asked questions. The primary goal of the guide. The guide is designed to empower residents, improve communication, and ensure that nursing homes operate as true communities where the residents have a voice. The motivation. The guide developed based on the recommendations of the NASEM report, which highlighted the need for a holistic quality improvement in nursing homes. And availability. The guide's available electronically as of right now, and we'll also be providing hard copies distributing to the nursing homes that we participate in the pilot. And so next steps, where we are right now and what are we going to expect? So we're currently working through that self-nomination process here in Connecticut where nursing homes are self-nominating to participate in the pilot. Education and resources will be provided to assist in this process for them. Following the nomination process, 25 homes are going to be selected to formally participate. And these homes are going to be the ones that receive that targeted support and resources from us in the Moving Forward Coalition. And And then, of course, but here in Connecticut, we really are so excited. We've got a lot of support from the industry, a lot of partners with the nursing facilities themselves. And so we want to make sure that we're supporting all the homes. So they're all going to have access to the guide and support from our program. And we want to ensure that every home can benefit from this pilot to the maximum capacity. And so, yeah, as I mentioned, Connecticut, we're super excited, super committed to this, the success of this pilot on empowering residents and through this council guide. And for any questions, of course, feel free to reach out to our staff by calling us at 1-866-388-1888 or giving us an email over at ltcop@ct.gov. So I believe now we can open it up to the floor and see if there's any additional questions for anybody else. So I'll hand it back over to you, Alice.
Fantastic. Thank you so much, Dan. Boy, you are great at presenting information that was so clear. And that was terrific that Elizabeth went first and, talked about kind of what we did in the New Jersey pilot, because that experience for everybody on the call, that informed how Connecticut is now approaching this next phase with not 4 nursing homes, but 25 nursing homes to start, and then expanding from there. There's something like 260, am I close, nursing homes in Connecticut?
Yeah, we have just about 200 homes. And to be honest, we've gotten some good feedback. And so I'm hoping that even though we're self-selecting 25 for the formal pilot, we'll be able to have some more feedback from other homes that are participating otherwise.
Fantastic. And I will also say, and Elizabeth, might want to say more about this, but we had really great feedback from the nursing home residents in New Jersey that participated in terms of, what they thought worked well, what they thought didn't work well. Some of the nursing homes used the guide more than others. Some didn't really use it much at all. So Elizabeth and I and Anna and Mairead, we kind of all circled back and said, okay, well, what is that telling us? And how do we want to do this going forward? So that actually led to the development of a short version of the guide that has a lot of links in it to make it easy for people who get overwhelmed with a document that's too long, but they can really, go through and find the resources that they need. So, lots of that. Isaac's just reminding everybody that if you'd like to ask a question of Dan, Elizabeth, Anna, myself, or any of us, please, click on the icon to raise your hand. And if you do that, we'll be able to allow you to unmute yourself and ask your question or make your point if you'd like to tell us about a resident council in your area. So Amy.
Hi. I have a question. I'm sorry.
Say what organization you're with or your state or something.
Oh, I'm in Connecticut. I'm sorry. I'm in Connecticut and not with an organization. I am a family member. I run a chair of our family council. And I work with Mairead and Dan, and hello. Anyway, my question is, I've always been, I'm trying to lower my hand. Anyway, I've always been confused with the fact that the staff run resident councils because of the fear of retaliation. I know that in my mom's home, the resident council, years ago, I was invited to sit in, and then that was with the old rec director, and then the new rec director called Mairead. This is before I was working with everybody, and reported me that I was not supposed to be sitting in on those meetings. But I know that when I was there, I helped out. Like, I'm like, my mom's not placed in her chair properly. And then someone goes, Roseanne says, I'm not placed in my chair properly. And Debbie says, you know what I mean? And so I've always been just confused or concerned, I don't know the right word, why it's run by staff.
Right. So that's a fabulous question. I'm going to let Anna start, and then Elizabeth or Dan may want to chime in too, because we've had a lot of discussions about this. Anna, do you want to comment?
Absolutely. And I think that's the perception right now, Amy, is that it falls under the facility leadership. Well, the facility leadership and whoever else from the facility, they're there to support. They're there to support the resident council. So first and foremost, this is why we're doing this education. This is why we formulated this guide to help them enhance their processes. So the way this should be, it's resident driven first and foremost. This is for the resident. They direct how they want it, who attends. We're here though, however, like we'll come up with an agenda, something that may help get them started. So we'll provide the tools and resources, but that is a misperception that we are trying to erase. First and foremost, this is for the residents. And we, as nurses, staff, leadership teams, we are there to support to make it successful. Did that help, Amy?
No, I'm not saying that.
That-
I think it should be run by the residents, yes, but
Yeah.
I also think I sort of like, just personally, sort of like the Ombudsman program. I know that it's very, there aren't enough of them, but maybe one of the volunteers of the Ombudsman program, I just know how in my mother's home, how people act, how the residents act differently. They'll tell me things differently, then they'll speak up at the resident council meeting.
So
That's what
I would say, to bring together what you guys are both talking about, if the residents are asked, and they should be asked, about whether or not they want to have family members, whether they want to have other guest speakers, then if the residents say, oh, we'd love to have so-and-so come to the meetings, it's so helpful, and those kinds of things, then that's the residents being empowered to make those decisions. And that is how it's supposed to be, how it's supposed to go. So I think your points are really well taken. And, a lot of nursing homes really value volunteers who will help to manage what the residents want to be doing. I know, Steve Maxwell wrote in the staff lead because it's easier than empowering residents who are capable of leadership. But does that take some work to do that empowerment? Yes, it does. So we can't fall back on that. That's why we said at the beginning, this is really about the intent of the regulations to have resident councils really run the way all of us would want to see them run together. So we have lots of other hands up.
Can I just respond quickly to Amy, just to validate? Hi, Amy. We've actually spoken
nice
a
to
while
see you.
ago.
Yeah.
I just want to first validate what your experience is. And I think there's many different reasons that staff end up running resident councils, right? Like some are because the residents actually want it that way. They prefer it, right? Like they don't really have the skills. The others, they don't have the skills. There's actually a training involved in, like you have to train people about how to facilitate meetings and doing things. And I just want to really validate the fear of retaliation can't really be overstated. It is a significant thing that many residents, I just can't overstate enough. It's constantly talked about among the residents when I'm working with them. And we really, sometimes that's a perception and a lot of time that's reality. And so that's something that we really need to work on together, all of us.
Yeah.
And Trisha put a really nice comment in the chat. I'll let people read that while we go to our next speaker. Thank you, Elizabeth. That was fabulous. Julia, you had a comment.
Yes. Hi. Thank you. This is really interesting and informative. I'm sort of a concrete thinker, and I just wanted to know if you could provide some of the examples of things that residents have brought up in these meetings. Sorry, I'm from the Henry and Marilyn Taub Foundation in New Jersey. I know that this meeting isn't focused on some of the more serious problems that we faced in New Jersey with nursing homes. I'm sure Elizabeth is very well aware of those, and the rest of you too. And my question may sort of end up leading to that, but I'm just curious about some of the concrete things that people bring up, that the residents bring up in these meetings, and how they're addressed, and how the follow-up could result in changes in the way things are done in the facility.
Well, I can start and say just a few things, and then Elizabeth or Dan or Anna can jump into. So I already mentioned, food and activities are sort of historically very high on the list of things residents often want to talk about. The other thing in the nursing home where we had to do with just the process of accessing their personal needs allowance or PNA dollars. And they had trouble figuring out how to do that. So that was something the nursing home was actually able to address, and the finance person came in and responded. So there was more to do on that. They also talked a lot about staffing because, again, across the country, it's a big issue. So they talked about workforce and CNA staffing and what could be done about that. So those are just some of the things that were specific and brought up. But Elizabeth, Anna, Dan, what else would you guys say come up?
This is Anna. Alice, I would also say what came up is the residents voice whatever the concern issue might be? What's the follow-up to that? And is it done in a timely manner? And can they report back at maybe the next month's meeting? So the follow-up to whatever they voice.
Great, great.
I'll just second what Anna said. That is without question. We call it closing the loop. Or that was one of the residents talked about. It's like, this is great. We get to like, these are just complaint sessions unless we're getting feedback about what's happening. And that ends up being one of the biggest challenges with it. People stop coming to resident council because I complain, and it doesn't mean that nothing is done. It's just that it's sometimes nothing is done, but lots of times it's just not reported back to the meeting. And that is a big issue.
Right, that is a huge issue. I just want to welcome Mairead Painter, who, Mairead, we were singing your praises for a lot of this, but we're so glad to see you in person. And we're in our discussion section now. And I just want to, before we go to the people whose hands are up, I do want to turn to Mag Morelli, because she was kind enough to say that she would say a few words on behalf of Leading Age in Connecticut. And Mag, what would you like to add to this discussion or highlight for the folks? Oh, okay. I clicked ask
Got
to.
it. Okay, I got it. All right. Thank you very much, Alice. And hi, Mairead. Good to see you. I'm Mag Morelli. I'm the president of Leading Age Connecticut, and we are the statewide membership association representing the nonprofit sector of nursing homes, as well as the rest of the long-term care continuum. I'm really pleased. Leading Age, we're really pleased to be supporting this. Very excited that this pilot's going to be, be in Connecticut. Only 25 nursing homes. I know more have responded and are excited about joining. So thank you for opening it up, not for the pilot, but for the assistance and the guidance. My colleague, Matt Barrett, who's the president of the Connecticut Association of Healthcare Facilities, could not. He got called away and couldn't be on the call, but he wanted to be here too, to throw his support of his association forward on this call. And I just want to say, we really are hopeful that there'll be some Leading Age members in the 25, not just to participate and to add to diversity of the group that's working, but also so they can provide us with constant feedback in our membership meetings, and we can learn from them and maybe also, discuss this pilot as it moves forward. So thank you, Mairead, for including us in this. We're really excited about it. And thank you, Alice.
Yeah, well, thank you, Meg. Thanks so much. And I would just reinforce what, again, you guys heard Dan talk about, which is, employers and nursing home owners, operators, and providers, so important to this work, because, this is about residents and the resident councils in all these nursing homes and integrating it and make it part of the culture so that it's not an add-on. It's something that is part of the culture that everybody working in that nursing home believes is so important to hear the voice of residents. So with that, Janine.
Alice, can I jump in? Matt did send me a quick message.
Go for it.
Okay, I just want to say that Matt Barrett from the American Healthcare Association sent a message that he wanted me to read. He said that, can I please express that Connecticut was selected for this project, and we are enthusiastically promoted the importance of having a vibrant participation by our members, and we're so pleased by receiving this extremely positive feedback, and that there's been an overwhelming response from the sector, and so that they're looking to institute this and hope that the selection process goes well, and looking forward to continuing to work with us. So I have to say, I really appreciate the support and the collaboration from both of our associations and the willingness for them to encourage their members to participate. So thank you.
Great. And thank you so much, Mairead. And Mairead or Dan, we've got a couple of people who've written in who are from Connecticut and would like to know, how can they, get more involved, or how can they be involved as you're selecting the 25 nursing homes? And then maybe after that, since we've talked about the next steps after that.
Yeah, I actually I just answered in the chat because I wasn't sure if you wanted it there. But basically, because facilities are self-nominating, we're still accepting potential applicants, and so we're looking kind of at geography. We want to get a good cross mix of different facilities throughout the state with different populations. So reach out. I put both Mairead and my emails into the chat. And so if you're a council president, council cabinet and the administration are both interested in it, reach out to us, and we're happy to continue the dialogue. And even if not part of the pilot, reach out anyway, because we're happy to continue to support you, whether you're part of the formal pilot or not.
Fantastic. Thank you so much for saying that. And Isaac and I would just add to what the Connecticut folks have shared. We have a lot of interest in other parts of the country. So there's people on this call who are not from Connecticut, but are interested in using the guide, putting a process in place, trialing it, learning, and, you know, fully implementing in their organization. So Isaac and I would say the Moving Forward Coalition really wants to support that. And, you know, Mairead and Anna have a national presence in this work, as well as their work in Connecticut. And if there are other states that really want to get going with this, and other organizations, not single nursing homes, but organizations that really want to come together, we are talking about how to do that, you know, having some regular scheduled calls to support and things like that. So Mairead, I don't know if you want to add anything to that, but that's, I think, where we are sort of right now, but we certainly want to continue to know if people are interested at all.
Absolutely. We want as much participation, not only here in Connecticut, but across the country. We want to get information back. So we are going to have some of those meetings, have opportunities for people to share what's working, where are there some opportunities for change. And so you'll see, I'm sure through the Moving Forward website, we'll be posting things and having that very active there.
Great. All right. Well, I want to go to the people who've been very patient raising their hands. Thank you, Mairead. Janine Ferrari.
Hey there. Hello. I founded a family council at my dad's nursing home 4 years ago, and we have tried to, and I'm the former family council liaison at the LTCCC. I'm no longer there because our grant ran out, but I'm still with my family council at my dad's nursing home. We have tried for the last 2 years to be invited to a resident council meeting. And they keep moving the goalposts, so to speak. They tell us, the administrators tell us that no one on the resident council wants us to be there. But when we speak to the residents afterwards, they want us there. But they don't do, just even working with the volunteer ombudsman who attends every resident council meeting, there's like a disconnect, and I cannot figure out how to connect these 3 points: the administration, the volunteer ombudsman, and the resident council president and vice president, so to speak. There just seems to be, because it's a volunteer ombudsman, she only comes there basically for that once a month resident council meeting, doesn't really talk to the residents unless there's complaints or something she has to check out. So the poor residents, you know, and most of them have cognitive decline. It's almost like Groundhog Day for them. Once a month, every month, they go through the same issues: food, staffing, more recreational activities, but nothing gets solved. They are very, very discouraged, and lots of them are starting to not attend the resident council meetings, though we tell them every week, please visit and please attend them, because that's where you get your voice heard. That, and they're also afraid of retaliation. So I'm sorry, this is a long-winded way to get to you and say, what is a family council or a family member to do when they see this?
So we have had this. Okay, I'm going to let Mairead answer. I knew Mairead or Elizabeth was going to jump in. It's a great point, and we have had lots of conversations about it. Go for it, Mairead.
I would say one, you can reach out to the regional ombudsman or the paid ombudsman, depending on what state you're in, for that area, not just the volunteer. And they can talk to the council board and ask. They should be, like, let's say one resident. If one resident says they want someone there, it should be brought to the board. It should come up and be voted on as to whether or not they want other individuals in the meetings, whether it's one time, maybe quarterly, biannually, or what that looks like in order to support the council. I think it is important for the resident council to be able to have time to speak privately with just residents, because it makes some people feel vulnerable if other people are in there all the time. Support, especially from the family council, to be attending, maybe quarterly, give information and support, I think would be appropriate.
Right. And all of these things, I just want to add to all the great feedback, going to the resident councils and learning each time, it's like, it really is like drinking from a fire hydrant sometimes. It was for me. There was so much each time that really shaped what we did. And every time I would talk to Elizabeth or Mairead or Anna, I would learn more. So some of this is really, it's what you were asking about, Janine. It's like, how can you get this to be different? And it's not an easy fix. It's not an overnight, quick, snap your fingers. Right. We all know that, right? But we are making progress. And this is a way, this protocol, this program is a way to keep making progress. So I want to call on Julia. Julia, you have had your hand up. Please unmute yourself if you can, and feel free to go ahead.
Hi, I'm Julia. I'm from Connecticut. I'm newer to long-term care, and our population is entirely dementia. So I was wondering what your advice for facilitating and encouraging, something to come out of the resident council meetings, as far as who would be appropriate to be involved and different things like that, because I do worry about family being a different niche as far as their needs, because they'll ask for one thing and the resident wants another. So that's where I'm hesitant, at least with our population.
Yes, it's a
Just
great
any advice is
helpful.
helpful.
Anna wants to answer that because Anna was just talking to us about working with people who are living with dementia.
Yes, and that's primarily what I do. I'm blessed to work with individuals with the different types of dementia. They still have a voice, and it's up to us to how do we project that voice. And you're right, sometimes their needs, wants, desires do not align with what the families. But even though they have a type of dementia, it still is their voice first and foremost. I know what I've done of some of mine. It may not work for you, it may. I encourage them different ways to express what their needs are. If they are able to write, draw, some may not be able to verbally articulate, but giving them another mode of communication, they will respond. It's up to us to best find out what meets their mode of communication. Did that make sense?
I think so. And I just chatted in also, thank you, Anna, that sometimes the local chapter of your Alzheimer's Association may be helpful. A lot of their work is community-based, but sometimes there are folks who can be brought into the conversation. So the other person who has her hand up is Paulette Hart. So Paulette, if you can unmute yourself, we'd love to hear from you.
Can you hear me now?
Yeah.
Oh, good. Okay. I just wanted to tell you that I am a resident of St. Joseph's Home in Enfield, and I am the president of our resident council. We've had it going on now for many years. It's been going on since before I even came here. And it really works well for us. I'll let you know that we have meetings only with the council of residents who are here. No staff is there. Nobody's there except the residents. And we do this because this is a chance for the residents to have any complaints brought that they want brought. And what we do is I make a list of questions or complaints that they have, and I take that to one of the sisters here in the home. And Sister Carolyn is the one on our floor. By the way, St. Joseph's is a combination retirement home, 2 floors of retirement, and one home is more of a nursing home for people who need more care. But anyway, I take this list to her, and she is wonderful about checking off the things that need to be done. So it really works out for us that way. But we also invite people in. If they wanted family members to come in and speak, that would work. If they wanted someone else to come in and speak, that would work. So while we keep the meetings to ourselves, we do this to protect, so to speak, protect the residents. We still are open to having other people come in and talk to us. And it works very well for us. It really does. And by the way, I'd like to get into that Connecticut thing. So I'm going to find out how to do that.
Paulette, please reach out to us. And I was going to say, you might want to, we might need to have you join our executive board of presidents at resident council too.
Oh,
Yeah.
well, that maybe.
Organizing. Always
Yeah.
organizing.
Okay.
But I agree with you, and I think having the opportunity for individuals to have that private time, and maybe you set up a, a quarterly meeting where it's a resident and family gathering to counsel in order to express concerns. But I think it's important for residents to have time by themselves to talk and support each other. And individuals who have different cognitive diagnoses. It's really important that they're there with their peers. We even have some that come to the legislature to talk about impact in laws related to individuals' cognitive changes. So having people voice things for themselves, and we don't always have the answers for them, but listening to them, as Anna said, to the best of their ability and understanding what they're trying to express to us is important.
And I'll just say, again, one of the things somebody earlier had asked about what kinds of things, do residents say during the resident council? And we have a very conscious effort to have it be a positive experience for people. So we don't want it to be just people coming and complaining, because then people leave and they're sort of deflated, and it isn't really what they're looking for. What they're looking for is really what Elizabeth was talking about earlier. They want people to recognize and value them as residents. They want to be able to say what matters to them, what really drives them and what matters. And then they want to see those things acted on, and as much as possible, even if it takes a while. So I think this has been a really great discussion today. I noticed that our senior program officer, Dr. Jane Carmody, has joined the call. And Jane, I know you've been listening intently and wanted to give you the opportunity if there's anything you'd like to add to this very rich conversation today. Oh, I got it. I unmuted you. You should be able to.
Thank you. Thank you very much. This has been fascinating. Alice, when we work with you and team and we talk about these plans, and we talked about Mairead being on part of this group and the work you're going to do in Connecticut, and this just, for me, brought it alive. It was just amazing to hear, and all the different ideas that's going to have to happen to make a successful resident council. Some been in place for years, and some might need to just start, and then everybody will work through it. Everybody will work through and create a great place for, as Alice says, for people to live and for people to want to work and to be respected. I just got through, at our board meeting is this week, and I just got through presenting the first couple of years' work on the Moving Forward Coalition, and everybody is very pleased and behind the work that you're doing. And we mentioned this work especially, and they said, well, how does that impact quality in a nursing home? And I said, well, Alice, and what we know, it starts here. It starts with what matters to the residents. So I really appreciate being here today, Alice, and thank you so much. And so good to see everyone. And thank you for those that are working hard every day in your nursing homes to improve care.
Fantastic. Thank you so much. We're very glad that our ears should have been ringing that you were talking to the board about this work. Well, I know we're coming up at the top of the hour, almost at the top of the hour, and just wanted to wrap up by talking about, and especially for Mairead and Dan and Anna, if they want to chime into what you all can expect in terms of further updates, because even though Moving Forward Coalition, as I mentioned, is doing national work and we're working with all of the states, our primary priority work right now is the Connecticut pilot. So I think Dan did a nice job in his slides talking a little bit about the next steps and kind of how things are rolling out. But Mairead, do you want to say anything more, or Dan or Anna, about kind of next steps, just over the next couple of months, what to expect, what these guys can expect, and how we might report back to them, again, on one of these coalition conversations or through our newsletter or anything like that.
Absolutely. So we're super excited. We've had I've seen some responses on here about people who want to get involved with the pilot. However, we hope it's not just the pilot, right? We want to see that this is something that's happening throughout the state. So if you have questions or concerns that you want addressed, you want to know how to do more, you can email us. But for our timeline, we're hoping to have the homes within the pilot identified within the next 8 weeks, somewhere around November, people will know. We're hoping to do a first call in December, and then start the kicking off of actually having the ombudsman or the partners that are going to be coaching in the buildings starting in January. And from there, it'll go about 18 months. Hopefully they'll be able to attend all of those care plan meetings and support the residents. And then we have a scheduled timeline of when they'll be doing larger meetings. For people not in the pilot, again, we're going to have stuff, we'll post it to the Moving Forward Coalition page so people can have information, and they'll be able to reach out, get support, and then participate in some larger meetings where we're getting feedback and learning from each other, and just hearing about, is the guide working? How does it work? What are the parts of it that are the most beneficial to you? Any tweaks you think we need to make? Because we want to continue to adjust it and make changes so that it is sort of a living and breathing product, and we can get it out to even more people.
Fantastic. Just many, many thanks. Isaac put his thanks in the chat as well. First of all, thanks to Isaac for always organizing these calls and running them from all different parts of the globe. But many thanks to Mairead, to Dan, to Anna, Elizabeth, Mag, and everybody else who contributed so much to this conversation today. Clearly, there is momentum around this issue, and it resonates with people in the public. Many of us on this call have meetings with people in the Senate, in the House, and your local state legislators, and those really matter. Policy change can happen from these kinds of initiatives. So very, very grateful to everyone on this call. Thank you so much for joining, and you will hear more from us. And again, Isaac chatted in where you can look at the guides. Dan and Mairead chatted in their contact information. You can reach out to Moving Forward Coalition anytime. We'd love to hear from you. So thank you so much, and hope everybody has a great rest of your evening. Thank you.
Thanks, everyone.